How to reduce anxiety and depression naturally. Nutritional supplements. The individuality of each person's biochemical processes is only now being recognized. The evolving field of functional medicine seeks to account for both genetic information and the unique differences that occur in each person's metabolism, including their increased need for certain nutrients. The following recommendations are based on a broad understanding of human brain chemistry and do not take into account individual differences. Note: organic foods rich in nutrients are the best source of nutrients for the body and mind. Basic nutritional supplementation. The following are frequently recommended daily for people suffering from mood disorders. B6 vitamin and mineral complex. Omega-3 essential fatty acids 1,000 to 3,000 mg of EPA/DHA per day. Vitamin D3, dosage varies according to vitamin D blood levels and season of the year, with a higher dose in the winter months. Probiotics that contain 2 or more live cultures. Other nutrients. B vitamins. It appears that taking vitamin B complex, which is required for the production and regulation of neurotransmitters linked to depression, is beneficial. A lack of B vitamins has been linked to mood disorders such as depression and anxiety. Elderly patients are especially vulnerable to B12 deficiency, and women on oral contraception or estrogen replacement are more vulnerable to B6 deficiency. Caution: consume after doctor's consultation. GABA. GABA is the neurotransmitter that is most responsible for calming a hyperactive brain. When taken as a supplement, it may have a calming effect and aid in muscle relaxation, but it is not well absorbed in the brain. Some people have discovered that taking it before bedtime helps to relax the body. Caution: consume after doctor's consultation. Inositol. Inositol, a B vitamin that the body can produce, may be beneficial when taken as a supplement in reducing anxiety, panic attacks, and OCD. Caution: inositol should be avoided if you have bipolar disorder. Magnesium glycinate, citrate, or oxide. This mineral is known to be a relaxant and may aid in the reduction of muscle tension, anxiety, and the promotion of sleep. Although there is little data in this area, many studies have found it to be promising. Caution: the oxide and citrate forms can result in loose stools. Folic acid. 1/3 of depressed adults have low folic acid levels, and depression is the most common symptom of folate deficiency. Some depression medications, for example, SSRIs, are less effective when there is a deficiency. N-acetylcysteine. This powerful antioxidant works in both the brain and the body and may be beneficial for anxiety, depression, and addiction. It has a calming effect and can be used in conjunction with medication. Caution: this antioxidant should be taken under the consultation of doctors and health practitioners. S-adenosylmethionine, SAMe. SAMe is a naturally occurring chemical substance that plays an important role in the production, regulation, and action of many neurotransmitters in the brain. While some studies have suggested that SAMe may be useful in the treatment of depression, the National Center for Complementary and Integrative Health, NCCIH, claims that the scientific evidence on SAMe is inconclusive because many of these studies were small and short-term. Caution: due to the possibility of gastrointestinal side effects, it is best to begin with a lower dose and gradually increase. It is best to use this under the supervision of a doctor, especially if combined with an antidepressant. SAMe should not be used in the treatment of bipolar disorder. Botanical medicines, also called natural products or holistic medicine. Sankt Johnswort. Herb/plant that influences several neurochemical pathways in the brain and aids in the treatment of mild to moderate depression. In numerous studies of mild to moderate depression, St. John's wort has been shown to be as effective as conventional antidepressants. Caution: this botanical may cause side effects, though the rate of side effects is lower than that of prescription drugs. There may also be herb/drug interactions, particularly with blood thinners. St. John's wort should not be taken with SSRIs, selective serotonin reuptake inhibitors, and may interfere with oral contraceptives. Do not take not for bipolar depression. Valerian. Used as a sedative and tranquilizer, particularly for sleep disorders. Because the research in this area is limited and inconsistent, there is no conclusive evidence that valerian may help with anxiety or depression. Caution: should be used under consultation with therapists or doctor. Rhodiola. Herbal adaptogen that may aid in the treatment of stress, anxiety, depression, and seasonal affective disorder, SAD. Should be consumed under consultation with therapists and doctors. Essential oils, aromatherapy. Aromatherapy with essential oils is a safe and effective treatment for anxiety and depression. Individual scent preferences may guide self-care. Lavender, chamomile, basil, and frankincense essential oils have been found to have a calming effect for those suffering from anxiety, whereas bergamot and peppermint oil are stimulating and can help those suffering from depression. Nature-based therapies. Being in nature can help to reduce anxiety and depression while also increasing pleasant feelings. People describe their feelings when they see a scene of natural beauty with words like calm, beauty, happiness, hope, and aliveness. Being connected to nature not only makes people feel better emotionally, but it also lowers blood pressure, heart rate, muscle tension, and stress hormone production, all of which are signs of stress and fear. So, if you're suffering from anxiety or depression, go for a walk in a park or green space, or work in your garden outside. Traditional Chinese medicine. Traditional Chinese medicine practitioners use herbs, acupuncture, movement practices, qigong and tai chi, massage, tue na, and other techniques to help individuals optimize their nutrition, activity, and internal energetic balance. Early studies have found acupuncture to be promising for mild to moderate depression, though larger reviews have not reached a consensus on whether or not it is effective in relieving anxiety and depression. Naturopathic medicine. Diet, exercise, natural botanicals and supplements, mind/body practice, hydrotherapy, and other tools are all part of naturopathy. Treatment with a naturopath can be combined with some form of psychotherapy. For those who prefer natural approaches can help anxiety and depression. Disclaimer: the information on this video should not be used as a substitute for medical treatment. Consult from a health or mental health provider.